Let's start off with the handle of the sword, which is the manubrium. The manubrium is quadrilateral in shape. It is the thickest and strongest part of the sternum. Now observe closely. It has two surfaces, anterior and posterior to the backside of the spine, and four borders. This one is the superior, then the inferior, and bilaterally we have two lateral borders. The anterior surface is convex from side to side, and if you look closely, it is almost rhomboid in shape. The posterior surface is concave and forms the anterior boundary of the superior mediastinum, which is basically the thoracic cavity. The superior border is thick, rounded, and concave. It has two notches in totality. One is the suprasternal notch, also known as the jugular notch or the interclavicular notch in the median part, and by the clavicular notch on each side. The significance of the clavicular notch is that it articulates with the medial end of the clavicle to form the sternoclavicular joint. The inferior border forms a secondary cartilaginous joint with the body of the sternum, called the manubriosternal joint. The manubrium makes a slight angle with the body, convex forwards, called the sternal angle of Louis. It is a very important surface landmark, and sometimes the examiner would ask you for its clinical significance. When you're counting the intercostal spaces, the easiest landmark would be the prominent angle of Louis, which is coinciding with the second intercostal space. So from there on, you can count the number of intercostal spaces. For example, if the examiner asks you to auscultate the apex beat, you know that the apex beat is auscultated in the fifth intercostal space. So you'll easily locate the fifth intercostal space starting from the angle of Louis. Coming to the features on the lateral border, there is a notch forming a primary cartilaginous joint with the first costal cartilage and presenting a demifacet for the synovial articulation with the upper part of the second costal cartilage. So we are done with the handle of the sword. Just focus on the two surfaces, the anterior and the posterior. Three notches, namely the sternal, we have the clavicular, and the notch for the first costal cartilage.